Caught early, prostate cancer has a 99% survival rate. Caught late, that number drops to 30%. The only thing standing between those two outcomes is knowing what to look for. Most men don't. Here is what nobody tells you. The men who get the late diagnosis, stage 3, stage 4, almost all of them had symptoms 1 to 3 years earlier. Real symptoms, physical symptoms. Symptoms they noticed, thought about, and explained away. Every single one of them had a reason it wasn't cancer, until it was. In this video, I am going to give you 15 specific signs, organized by how your body actually produces them, that the medical system almost never explains to men before it is too late. I am also going to tell you about one sign that has nothing to do with urination, nothing to do with pain, and that almost every man over 50 is experiencing right now and calling it something else entirely. If you are a man over 50, or if you love one, the next 18 minutes could be the most important thing you watch this year. Not because I want to frighten you, because the difference between a simple blood test today and brutal treatment 2 years from now is almost always just one thing: information. Let's get you that information. Everything you are about to hear comes from published research by Johns Hopkins, the National Cancer Institute, and the American Cancer Society. Plain language, real science, starting now. Before we go through all 15 signs, I need to say one thing directly. If you have been dismissing symptoms, brushing things off, telling yourself it is just age, avoiding the doctor because you are not sure it is serious enough, that is not weakness. That is not failure. That is what happens when a man spends 50 years in a culture that treats physical vulnerability like a character flaw. You were not being careless. You were operating on the information you were given. And when it comes to prostate health, that information is almost universally inadequate. The medical system has a specific and consequential gap here. Most doctors will not proactively bring up prostate screening unless you raise it yourself, or unless your symptoms are already advanced. Most men don't know screening is recommended from 50 for average risk, and from 40 to 45 for higher risk groups. That information does not get handed to you. You have to go looking for it. That changes right now. Let's start. Everything in this video is grounded in peer-reviewed medical literature. The American Cancer Society, the National Institutes of Health, Johns Hopkins Medicine, the CDC, and the Prostate Cancer Foundation. This is clinical data in plain language. Here are 3 numbers you need before we go any further. Prostate cancer is the most commonly diagnosed cancer in American men after skin cancer. Over 268,000 new cases every year. 1 in 8 men will face this diagnosis in their lifetime, and this one, which deserves far more attention than it receives. Black men in America are 70% more likely to develop prostate cancer than white men, and more than twice as likely to die from it. That disparity is not genetic inevitability. It is a screening gap. It is a solvable problem. And awareness is where solutions begin. Now, 15 signs, 4 categories, organized in the order your body actually communicates when something is wrong. Let's go. Before we begin, I want to tell you about sign number 15. It is last on this list deliberately. Not because it is least important, because it may be the most important sign of all. It has nothing to do with urination, nothing to do with pain, nothing to do with any body part you would naturally connect to prostate cancer. It feels, to almost every man who experiences it, like a completely ordinary part of life after 50. It is not. I am saving it for last because I want you to have the full biological context when you hear it. That context is what will make it impossible for you to dismiss it the way men have been dismissing it for years. Stay with me until sign 15. And after all 15 signs, I am going to give you a specific 3-step action plan. Free, concrete, and immediately usable that could change the outcome of your next doctor's appointment. Do not leave before you hear both. Category 1, the plumbing signals. The first 5 signs all come from the same place. Your prostate wraps directly around the tube that carries urine out of your body. When something is wrong, cancer, inflammation, abnormal growth, that tube gets squeezed. These 5 signs are what a squeezed tube feels like. They are not dramatic, they are not painful, they are quiet, and that quietness is exactly what makes them dangerous. Sign 1. Weak or slow stream. Think back. 10 years ago, how did your urine stream feel? Forceful, direct, consistent. How does it feel now? If the answer is weaker, thinner, slower, that is not aging. That is compression. Your prostate is physically narrowing the passage urine flows through. This is the earliest mechanical signal your body can produce. Most men notice it. Almost none of them mention it to a doctor. Don't be most men. Sign 2. Stop-start stream. You start, you slow down, you almost stop, then it picks up again. This is called an intermittent stream. Here is what that stop-start pattern actually means. The obstruction is incomplete, which means you are still in an early window. The tube is being squeezed but not yet closed. That window matters enormously. A stop-start stream today, investigated today, is a completely different medical conversation than that same symptom ignored for another 18 months. The window is open. Use it. Sign 3. Sudden overwhelming urge. Not a gradual build, not the normal manageable sense that a bathroom would be a good idea soon. A sudden, urgent, overwhelming need. The kind where you genuinely question whether you are going to make it. Here is what is actually happening. Your bladder is not necessarily full. Your prostate is pressing on the nerve network surrounding it and sending false alarm signals directly to your brain. The urgency is not about fluid. It is about a physical presence pressing on nerves that were not designed to be pressed. Your body is not overreacting. It is reporting accurately. Listen to it. Sign 4. Waking multiple times at night. This is the most dismissed sign on the entire list. I want to say that with complete directness. If you are waking up 2, 3, 4 times a night to urinate, and you have been telling yourself this is just what getting older feels like, it is not. Nocturia at that frequency is a signal. Either your bladder is not fully emptying during the day, so it refills and triggers urgency faster at night, or your prostate is firing urgency signals even while your body is completely at rest. Your body does not waste energy. When it wakes you up repeatedly during the only quiet hours it has, it is doing that for a reason. That reason deserves an answer. Sign 5. Incomplete emptying. You urinate. You walk away. Within minutes, sometimes seconds, the urge is back. Or you carry a feeling throughout the entire day that something is always left. A pressure that never fully resolves. A sense that the job is never quite done. This is called incomplete voiding. The compressed urethra is physically preventing full drainage. Urine sits in the bladder. And here is what most men never get told about that pooled urine. It becomes a breeding ground for infection. Recurrent urinary tract infections in men over 50, with no other clear cause, are frequently traced back here. The infection is the symptom. The prostate is the cause. Treat the cause. Category 1. Close. 5 signs. 1 mechanism. A prostate pressing on a tube it was never supposed to press on. If 2 or more of those signs are familiar to you, write them down right now. You are going to need that list for the action plan at the end of this video. Category 2. The pain signals men misattribute. This category is responsible, more than any other, for the time men lose between their first symptom and their first diagnosis. Not because men ignore these signs, they don't. They notice them, think about them, and assign them a different cause. A gym session, an old injury, just getting older. And every wrong explanation costs weeks, sometimes months, sometimes more. Sign 6. Persistent lower back ache. Not sharp, not acute, not the kind of pain that stops you mid-step. Just a low-grade background ache in the lower back, always there. never quite bad enough to be alarming, completely resistant to rest, stretching, or anti-inflammatories. When prostate cancer develops, it can press on pelvic nerves that refer pain directly to the lower back. In more advanced cases, it begins affecting the vertebrae and bone tissue in that region. Here is the rule. Lower back pain with no clear musculoskeletal cause that does not respond to standard treatment and that coexists with any urinary changes must include the prostate in the conversation, not as a first guess, as a possibility that is specifically ruled out. Sign 7. Pelvic pressure or heaviness. This one is difficult to describe, which is exactly why it almost never makes it into a medical appointment. It is not quite pain, it is more like weight, a sense of fullness or pressure deep in the pelvic region, as though something is sitting where it should not be sitting. That is, in a very literal biological sense, exactly what is happening. If you have been experiencing this and dismissing it because you could not find the right words, here are the right words. Pelvic pressure, pelvic heaviness. Use them at your next appointment. Your doctor will know exactly what to do with them. Sign 8. Hip, thigh, or groin pain. Without obvious cause. Most men attribute this immediately to arthritis, sciatica, an old injury, or general joint wear. And in most cases, those attributions are correct. But prostate cancer has a documented tendency to spread to the pelvic and hip bones relatively early in its metastatic progression. The hip, the femur, the pelvic bone, priority targets. The rule here is the same as the back pain rule. Hip or thigh pain that is persistent has no clear injury origin and coexists with anything else on this list. Flag it, specifically, by name, at your next appointment. Sign 9. Burning or pain. During urination, the automatic assumption is a urinary tract infection, and often that is correct. But here is the critical distinction. UT is come with other symptoms: fever, sudden onset, cloudy urine, general malaise. Burning during urination that arrives gradually, persists over weeks or months, comes and goes without fully resolving, and does not respond clearly to antibiotics. That pattern points toward the prostate. Recurring urinary burning without a consistent infectious cause is a signal worth pursuing persistently until a clear explanation is found. Do not stop asking until you have one. Sign 10. Discomfort in the perineum. The perineum is the soft tissue area between the base of the scrotum and the rectum. Most men have never had a reason to think about this part of their body, but the prostate sits directly above it, separated by only a thin layer of tissue. When the prostate is affected by cancer, inflammation, or enlargement, pressure, discomfort, or sensitivity in the perineum is a direct anatomical consequence. If you experience chronic discomfort, heaviness, or sensitivity in that area without explanation, that is your prostate communicating through the tissue nearest to it. Name it to your doctor. Use the word perineum. They will know exactly what it means. Category 3. The signals. Men are too embarrassed to mention. I want to say something directly before this category. Every year, men die from prostate cancer at stages where survival was still highly probable because they saw a symptom, felt a wave of shame, and chose silence. Not because they did not care, not because they were not frightened, but because the symptom existed in a part of life where men have been taught their entire lives that vulnerability is not acceptable. This category is where that conditioning does the most damage. There is nothing in the next 4 signs that should cause you a single second of embarrassment. These are biological events. They are clinical data, and they could save your life. Sign 11. Blood in the urine. A pink tinge, a brighter red, a dark rust brown color. It can present in any of these ways. Here is what makes this sign uniquely dangerous. It is frequently intermittent. It appears. It disappears. And when it disappears, the relief is so powerful that men convince themselves it was nothing. It was not nothing. Blood in the urine, Even once, even briefly, even if it completely disappeared and has not returned, is a medical event that requires investigation. The disappearance does not mean the cause has resolved. It means it has gone quiet. Quiet is not the same as gone. Sign 12, blood in the semen. This sign produces, in almost every man who experiences it, an immediate emotional reaction: fear, shock, confusion, followed almost immediately by silence. Men do not tell their partners. They do not call their doctors. They wait and hope it does not happen again. This is called hematospermia. It indicates involvement of either the prostate or the seminal vesicles, two glands that sit in direct contact with the prostate. This is your body producing one of its most specific and direct signals. It is not subtle. It is not ambiguous. Report it immediately. This is not a wait-and-see situation. Sign 13, painful or reduced ejaculation. The nerve bundles and ductal structures responsible for ejaculation run directly through and alongside the prostate. When the prostate is compromised by cancer, inflammation, or significant enlargement, those structures are affected. The result can be ejaculation that has become painful, noticeably reduced in volume, or both. This is not an inevitable feature of aging. A gradual reduction over many years can have multiple causes, but a noticeable change that arrived within a specific time window. That is a neurological and structural signal pointing directly at the prostate. It deserves a medical conversation, regardless of how uncomfortable that conversation feels to start. Sign 14, sudden erectile dysfunction. With no other clear cause. The emphasis belongs entirely on the word sudden. Gradual changes in erectile function across many years. Cardiovascular health, hormones, medication, psychological factors. Those have multiple possible explanations, but erectile dysfunction that arrives relatively suddenly in a man whose cardiovascular health is otherwise stable, who has not started new medications, and who has no significant psychological stressors. That pattern is clinically significant. The neurovascular bundles essential to erectile function run directly alongside the prostate. When the prostate is affected, those bundles are affected. Sudden onset ED in a man over 50 without a clear alternative explanation should prompt a prostate evaluation. Not just a hormone panel, a prostate evaluation. Category 4, the whole body signal, sign 15, unexplained fatigue. That sleep does not fix. Here it is, not ordinary tiredness, not the fatigue of a long week or a run of poor nights, a specific, qualitatively different kind of exhaustion, present when you wake up in the morning, present at midday, present at the end of the evening, and completely unresponsive to rest, sleep, or recovery. A fatigue that feels like it is coming from somewhere inside you rather than from your schedule. Here is the biology. When your immune system detects abnormal cell activity, which is what cancer is, it does not post a notice. It mobilizes. It diverts metabolic resources. It produces inflammatory molecules called cytokines, which are extraordinarily energy intensive to produce. The result of that sustained internal immune mobilization is a fatigue that feels fundamentally different from anything you have experienced before. Here is what I need you to do with this information. If you have been carrying a deep, persistent, unexplained exhaustion, one you have been calling stress, or age, or just life, and that exhaustion coexists with even 2 or 3 other signs from this list, do not give it another name. Do not normalize it. Add it to the list. Bring it to your doctor. Because this particular tiredness is your immune system working overtime. And it is working overtime for a reason. 3 additional whole body signals deserve naming clearly alongside the fatigue. Unexplained weight loss, not from diet or exercise, but weight dropping without cause. Swelling in the legs or feet, from lymphatic involvement when cancer affects nearby lymph nodes, and loss of bladder or bowel control, produced by cancer pressing on the nerve pathways governing those functions. These three are frequently the signs that finally bring a man to a doctor, and frequently, by that point, the window has narrowed considerably. Do not wait for these. The earlier signs on this list are the ones that matter most. The story, David. I want to tell you about a man I am going to call David, 57 years old, physically active, non-smoker, no family history of prostate cancer that he knew of. Over 18 months, David noticed 4 things. His urine stream had become noticeably weaker. He was waking up twice every night. He had a persistent dull ache in his lower back that never fully resolved. And he was tired, consistently, deeply tired, in a way that felt different from anything before. He had an explanation for every single one. The stream, not drinking enough water while traveling for work. The night waking, stress, disrupted sleep, getting older, the back pain, definitely the gym. He remembered the exact session he blamed it on. The fatigue, long hours, pressure, 57 years old. Every explanation was reasonable. Every explanation felt true. Every explanation bought the cancer another month. He finally went to his GP, but about the back pain, because that was the symptom he felt most comfortable presenting. An X-ray was ordered, nothing obviously concerning. Anti-inflammatory medication, rest. Come back if things don't improve. He didn't go back. Things didn't dramatically worsen. He learned to accommodate the pain. 14 months later, stage 3 prostate cancer. He had surgery, radiation, a treatment process that was physically and emotionally brutal in ways he had not been prepared for. He came through it, but his outcome, the complexity of treatment, the length of recovery, the uncertainty of those early months, was directly shaped by the stage at which his cancer was found. He said something I have thought about many times since. Every sign was there. I just did not know I was supposed to add them up. That is what this video is. Not a list of scary statistics, not a reason to panic. It is the guide that nobody gave David. And it is the information that, if you use it, could mean your story ends very differently than his almost did. 3-step action plan. 15 signs. Now here is exactly what to do with them. Step 1. Know your personal risk level and when screening should begin. This is not one size fits all. Average risk, no significant family history. The American Cancer Society recommends the screening conversation begins at 50. If you are a black man, or if your father, brother, or son has been diagnosed, that conversation begins at 40 to 45. If you carry a BRCA1 or BRCA2 gene mutation, speak to your doctor about beginning evaluation at 40. These are not overcautious guidelines. They are grounded in the statistical reality of when risk begins to elevate. Know which category you are in. Today. Step 2. Ask for 2 specific tests by name at your next appointment. The first is the PSA blood test, prostate-specific antigen, a protein produced by both healthy and cancerous prostate cells. Elevated levels can indicate cancer, though not exclusively, which is why it is one piece of a diagnostic picture, not a definitive answer on its own. It is a simple blood draw, 5 minutes, covered by most insurance plans. Ask for it by name. The second is the DRE, the digital rectal exam. I know this is the test men joke about to avoid having it. Set that aside. A DRE takes 30 seconds. It allows your doctor to physically assess the size, shape, and texture of the prostate, identifying irregularities a blood test cannot detect. Your doctor will not always offer it unprompted. Walk in and ask for it. 30 seconds. That is the entire cost. Pay it. Step 3. Document your symptoms in writing before your appointment. This sounds almost too simple to matter. It is not. Take a screenshot of this video. Go through the 15 signs. Write down honestly which ones you have experienced, how frequently, for how long, how severe. Bring that written list to your appointment. Research consistently shows that physicians respond differently to written symptom documentation than to verbal accounts. Written notes signal preparation. They prevent the common experience of arriving at the appointment, feeling fine in the moment, and walking out without having mentioned the things that brought you there in the first place. 2 weeks of written symptom tracking could meaningfully change the outcome of that conversation. Do not skip this step. Conclusion: 15 signs, 4 categories, 1 consistent truth underneath all of them. Your body does not go quietly. It signals, it repeats, it escalates. The problem has never been the signals. The problem has been not knowing the language. You know it now. If nothing else from this video stays with you, let these 3 stay. The nocturia, the lower back pain, the unexplained fatigue. Those 3 appear most consistently in the stories of men who received late diagnoses. Write them down if you need to. Put them somewhere you will see them. Then do one more thing. Think of one man in your life. One man over 50 who you respect, who you care about, who has never watched a video like this and probably won't go looking for one, and send this to him. Not with a big message, not with alarm, just, "Here, I thought this was worth watching." Because the difference between a stage 1 diagnosis and a stage 3 diagnosis is often not medicine. It is often just one person sharing one piece of information at the right moment. One question for the comments. And I read every single one. Which of these 15 signs are you hearing about for the very first time today? Tell me. Your answer helps me understand what information is missing, and it helps the next person who reads the comments feel less alone in what they are experiencing. If this video gave you something your doctor has not, hit subscribe. That is what this channel is built for. To give you the information that should have been yours all along. Take care of yourself. You now have the knowledge. Use it.